the last several days who are afraid of being victims of violence themselves, who are afraid of being victims of discrimination in school and in places of employment. And what's unfortunate about this is that we tend to see this happen after each of these mass shootings. For people with disabilities, particularly neurological or psychiatric disabilities, both of which are some of the most stigmatized in our society, the response to these kinds of tragic shootings is twofold. We feel the same kind of mourning and sympathy for the victims as anyone else, but we're also faced with a very unique and horrifying kind of fear, because we know it's only a matter of time before people start to try and blame us. Yeah, and that's just unacceptable.
I mean, you wonder that, I mean, Professor Hemingway's research has shown there are pretty relatively, I don't know, obvious perhaps public health strategies for reducing gun violence, and yet you think this sort of discussion is going to lead more to a discussion of how to control or surveil, potentially, what's being presented then as a potentially dangerous segment of the population, Ari?
You're absolutely right. In the aftermath of Virginia Tech, many universities adopted campus mental health policies that actively discriminated against students with psychiatric disabilities. Autistic people, people with other disabilities actually face tremendous rates of not just discrimination, but out-and-out segregation in school, in the workplace, in communities. The last thing we need is to ignore the progress of the disability rights movement, and to see this happen 22 years after the passage of the Americans with Disabilities Act is profoundly disappointing. We need a better conversation.
Professor, you wanted to come in there, I think.
I think there are two problems with the blog. She's conflating two things. It's a wrenching story, obviously. She's dealing with a son who clearly is struggling and is mentally ill and is threatening and is menacing. But unfortunately, linking this mentally ill kid with the risk of violence creates this whole problem that we're talking about. Epidemiologically, most mental illness actually manifests early in life, in the teen years, and 3/4 of all psychopathology that adults have is already present by the time, people are young adults and teenagers. But it's really the minority of these people who actually carry out violent acts. And by writing about her son in this way, she's conflated these two, and I think, contributed to exactly what Ari is talking about. She happens to have one of these children who is severely mentally ill and appears to be at risk of violence, and that he's quite menacing.
At the very
least, he is rare.
At the very least, they might have put a spotlight, though, on the lack of support to parents in her position and the lack of mental health funding as a whole. Is that at least some potentially positive aspect of this?
We want to be very careful about that, because I don't think we want to leave people with the impression that what happened in Connecticut was about lack of mental health services. That implies that people with disabilities who don't receive the services we need are in some ways ticking bomb, and quite frankly, that's just not true. I have to wonder what the experience for this young man must be like, having had to go back to school yesterday and today with all of his classmates and educators, knowing that his mother thinks that he is a potential mass murderer in the making.
Professor Hemingway, let's then switch in the last 5 minutes or so to this public health model, this pragmatic, science-based, practical approach to gun violence. What exactly do we mean by a public health model?
Well, the big thing is that it's about prevention, and that it's far more than about criminal justice. It's about getting everybody involved, from not only police, of course, but physicians and the media and the clergy and even gun owners. And so the example that's often given is if you look at motor vehicle deaths over the past 50 years, if you can make an argument that virtually all the fatalities are due to bad driving, either driver error or drivers deliberately not obeying the law. And maybe we should focus all our attention on the driver. But it turns out that's not the correct approach. What we've done in the past 50 years is made the car safer, we made the road safer, we made the EMS system better, and still It's very hard to change humans, and nobody thinks drivers are any better today, but we've reduced motor vehicle fatalities by over 90%. And so what we want to do in the area about gun violence is, just as we have lots of cars, we have to learn to live with cars. We have lots of guns in the United States, we have to learn to live with them. And we have to have sensible laws about guns, which we don't. But also then we also have to have lots of groups getting together and trying to do their best to help. So we want physicians to talk to their patients about guns if somebody is mentally unstable. One of the things that we want to really do,
So behavioral science and mental health research does have a part to play then in the public health model then?
Absolutely. Absolutely. Everybody has a part to play. And the key thing is, don't just focus on the final actor, but try to make it hard to behave inappropriately, try to make it hard to behave, to do things in accidents. And when somebody does make a mistake or behave inappropriately, that nothing terrible happens. What I would argue is that one of the many, many things we could do, for example, is we're trying to create an 11th commandment for gun safety, which is equivalent to friends don't let friends drive drunk. And that commandment is friends don't let friends have guns around when they're going through a bad patch. And we know that when your wife leaves you or you feel terrible or whatever, if there's a gun around, you're so much more likely to die in a suicide. And so what we would have liked to have seen is here was a mom in Newtown, and her son was not doing well. And so rather than have 5 guns in her house, what we would like to have seen is her friends, who are probably also gun owners, come to her and say, wouldn't it be smart to get rid of these guns, not forever, but for a while, maybe till the son leaves the house or is getting better or whatever. And I think not having the guns in the house would have probably prevented the suicide, because this was a suicide, that's what this was. And would also have prevented the catastrophe occurring in the elementary school.
Professor Hemingway, I mean, looking at the data that you've studied there, I mean, I mean, at the moment then we see people seizing towards then, deciding that perhaps mentally ill people are some sort of enemy, potential enemy within. But there's also this discussion then about the need for concealed weapons and the need for weapons to be used in self-defense as a way out of this. But you've done a lot of study on these areas as well.
Yeah, well. Yeah, I mean, this argument is so strange. 40 years ago on All in the Family, when we had lots of gun hijackings, Archie Bunker said, oh, the way to stop them is to arm all the passengers. And that was a joke then, and it's still a joke now. That's not the way we know from 25 other industrialized democracies, that the way to go is not to get more and more arms, but to get fewer and fewer. We even learned that in the Old West. In Dodge City, the way was not to arm all the residents, but to have reasonable gun control laws, and that's what really tamed the West. So we can do lots better. And what I would like to see in the United States right now is one of the things is just decide on one crucial policy that could really help, and that policy would be something like universal background checks, and try to get every senator, every congressman to stand up and say, do you believe in this or not? And if you don't believe in universal background checks, I would love for you to tell that to your 7-year-old daughter, or to go to some elementary school and explain that to the second graders, why you are against having background checks for criminals.
Well, that does lead to that question then, Dr. Friedman. Instead, though, what we're having is the White House and others saying, well, we shouldn't act too quickly. It's complicated. It's to do with mental illness. Incidentally, while negotiating further reductions in the social safety net. And actually, we're also seeing a spike in gun sales as well, specifically of the kind of combat weapons used in mass shootings. So do you think anything has changed this time around, or is it just a repetition of the same?
Yes, well, I think actually this may be a turning point in the sense that the slaughter of innocent children and strangers to the perpetrator in this case is a terrifying prospect. Most people look at this and they think, there's no reason to think that my children could be safe either from somebody who obtains lethal weapons. The dialogue in the country seems to suggest that there is the possibility for a turning point. I would just add that it's very, very hard to control human behavior. Obviously, we're not going to control and we can't change human nature. The only thing really we can do is to change or modify its expression. And to me, this means changing the accessibility to guns. I mean, when I was growing up, a bully in school, the most damage that he could do is give somebody a bloody nose. And now when you have a young man who's disgruntled and unhappy and perhaps mentally ill, and he has easy access to an AK-47 or some assault rifle, you have a mass killing.
All right, we're going to leave it there. Dr. Richard Friedman, thank you very much.
I think that's.
Professor Hemingway, thank you as well. Ari Neyman,
thank you much.
too.
Thank you.
Thank you very much for having me on the show.
And that's it from the team in Washington, D.C. for now. Don't forget to follow us on Twitter and Facebook.